Everyone. My name is Rick Reikenis, and I'm the 2021 chair of the Chamber of Commerce of the Palm Beaches. We want to welcome you to our March corporate breakfast. Today's program features 4 outstanding Palm Beach County residents and CEOs who are leaders for our local hospitals. And we're going to be having a hospital CEO panel discussion on a year of COVID. Very exciting. Actually, it's been a year of a lot of challenges, uncertainty, feeling like the earth is moving out from under our feet. And our hospitals, our medical professionals, and our staffs have been on the front lines of this fight. And we thought it would be interesting today to and very timely to spend some time with them after the past year that we've been having, to find out from them what they've learned and learn from them based about their experiences and how they've managed during this year. But before we get started, I want to thank our 2021 technology sponsor, Baptist Health, who is represented today by Michelle McGovern, Director of Government and Community Relations and Board Chair. Thanks, Michelle. We appreciate all you do to sponsor all of our annual programs, and so that we can continue to deliver programs like this to keep our board, trustees, chamber members, ambassadors, and local community leaders informed with timely information before it leaks out to the general public. We always like to be the first ones to know. Speaking of technology, let me also invite you to check 3 things right now. Before we start our program together that are what we call Zoom best practices. I'd like for you to silence your cell phones. Most of you are going to be off camera. Remain muted. We will be having time for Q&A, questions and answers, at 8:40 a.m. this morning. What we'd like to do is have you type in your questions in the chat box. We'll go ahead and relay those questions to the panel in the order in which they are received. Now I would like to introduce to you and welcome our 4 speakers who have joined us today for this program. We have Good Sam Medical Center, Good Samaritan Medical Center, Sheri Montgomery, CEO, Lincoln Mendez, who is the CEO of Boca Raton Regional Hospital, Cynthia McCauley, St. Mary's Medical Center and the Palm Beach Children's Hospital, CEO, and Amit Rastogi, President and CEO of Jupiter Medical Center. Welcome all, folks. What we'd like to do now is go ahead and start with the show, because we've got an awful lot of stuff to talk about. And we want to start picking your brains about what you've learned and how you've reacted, and what sort of things we're going to go ahead and carry on from here after, as we sort of get out of this COVID crisis, and what happens from now on. But lessons learned. Sheri, I'd like to start with you. With your organization, when did you start really seeing that COVID was going to be a real issue, and how did you start reacting to it? What were some of the first things that you guys as a staff and as an organization talked about, and how this was going to impact you and how you would react to the crisis?
Yeah, I think early March is when we started noticing things that were going on in other hospitals in the northern part of the country. I think one of the benefits of being part of a large healthcare organization like Tenet is we have hospitals throughout the country. So one benefit, unfortunately, for the hospitals that faced it first were that they communicated to the other hospitals throughout Tenet things that were happening in their organization throughout the hospitals with COVID. So we probably had a 3-month advance on it. So we probably hit the spike in July, I believe it was. Mm-hmm. But having our colleagues face it first gave a benefit to the hospitals, I believe, in Florida. So as you know, hospitals are constantly facing different type of emergencies. In Florida, we face hurricanes. So we prepare for emergencies all the time. So we have incident command centers. And I think, activating that early on was very helpful. It's a very structured type process and getting the right leaders at the table. I think having our home office at Tenant Corporate organizing different calls and best practices was very helpful early on for us.
Okay, thanks. Lincoln, so basically, we had a lot of people being very nervous about what to do with COVID, how to behave. Should they have elective surgery? Should they not have elective surgery? I think everybody from government, top government on down was feeling their way through this thing. How did you guys react to, and how did you have your decisions made to make sure you had enough things like PPP in stock, how to protect your staff, patients that were coming in, doctors, so on and so forth? How did you, I know things became very different very quickly.
Yeah, it's similar to what Sheri was talking about. I think the first news that we got in the country, if you recall, was pretty much in the Seattle, the Washington State area. And it was interesting because a lot of the folks, even on our medical staff that had some acquaintances in that part of the country, they were hearing all these horror stories. So and those were filtering down to the staff before the pandemic hit. So we actually admitted our first patient on March the 9th. But again, to Sheri's point, all of the hospitals here in South Florida have incident command process in place. So we know how to prepare for emergencies. So we activated that plan. So we're meeting with the medical staff, we're meeting with the hospital staff, the key folks, just to make sure that we are planning for what we didn't even know was coming down the pike. You asked about PPE supplies. That was probably one of the biggest challenges. So the first wave, if you will, peaked around the 1st of April. So around this time last year is when the first wave peaked out. And our biggest challenge back then was just supplies. And we didn't really know the treatment protocols yet, what's the best practices. So there was a learning curve in that first wave, but I think that first wave, it came and went fairly quickly, but it helped us prepare for the second wave, which really peaked in the middle of July. That's the one there was a lot of challenges in terms of ventilators, PPE supplies, et cetera, and staffing started becoming an issue too. So we're doing a lot of things. We're having dedicated COVID units just to make sure that we isolated those patients in one part of the hospital and really restricted the amount of staff, the hospital staff and medical staff that was going in and out of there. And then you mentioned visiting hours. I mean, that was always the challenge itself. Elective surgeries. By that time, we were all pretty much shut down with elective surgery. So there was a lot of communication going on during that time.
I know in our business, in the business community, restaurants, offices, banks and all that, everybody was in a major panic. Employees were in a major panic. People didn't know if they were safe or not coming to work. Did they need to stay home? We'd gone to shutdowns, then maybe not so shutdowns, then whatever. You guys were not able to shut down. You guys had to keep going. So Cynthia, with regards to your employees, your staff, how did you get them to understand that the precautions are being taken, that this is a safe work environment for them, how to behave, and, with people coming into the hospital and that kind of thing? I guess you're, for lack of a better word, HR, employee health, and taking care of your peeps, sort of a thing.
Right. So probably very much like my colleagues here, we had our incident command met twice a day, and we had an intranet set up where employees could send questions. So as we were meeting as an incident command, we were pushing that information down on our internal intranet. Mm-hmm. And then employees could send back questions that weren't on that. But more importantly, we rounded on those units. Because there was only a select number of units that were COVID units. So similar to what Lincoln was saying, we had designated areas that were specifically for COVID patients, so that ensured we had these safe places for other patients and employees. So it was a lot about education, constantly in front of them explaining how to don and doff PPE. talked a lot about hand washing, which we should still talk about today. How do you wash your hands? We did a lot of videos. So it was constant communication, over communicate if you want to know. We had newsletters go out through our emails. Candid on COVID, we did a lot of video vignettes. We engaged some staff to actually do videos to help educate, and we have a phenomenal medical staff, particularly our infectious disease, our trauma team, who assisted. So it wasn't one person or one venue, it was multifaceted with many, many, many persons involved.
Okay, great. I know in the beginning, everybody put elective surgeries on hold, just because. I think everybody thought, well, maybe the thinking was we're going to need our hospital space for COVID patients or whatever the thinking was. So Amit, a question for you is at Jupiter Medical Center, and maybe this is something for all of you too to consider. So there is a certain amount of, my background is an engineer. I look at trends, I look at metrics. And so you can always count on a certain amount of certain types of elective surgeries taking place in a community. So here in South Florida, population a little bit older. So we have things like knee replacements, hip surgeries, orthopedics, different types of elective surgeries that got put on hold for a while. Now, those people who needed those knees replaced and hip surgeries and rotator cuff surgeries didn't go away. They came up. And so there was sort of a buildup of the need of these elective surgeries. So basically, how much, I'm curious to know, how much of these elective surgeries got postponed, and are you now seeing that backlog, that dam sort of starting to burst, and how are you handling that? Or is it being managed, pretty well, just from Jupiter Medical Center standpoint?
Sure. Yeah. So that was definitely, I think, a challenge for all of us on the medical center side is, how do we actually manage the whole process? And we couldn't do elective surgeries because, clearly those patients who are undergoing those, and again, just to be clear for folks, and I know you've mentioned this a little bit, Rick, elective procedures are not kind of cosmetic procedures. These are still medically necessary procedures, just not urgent ones. And they could be orthopedic, they could be cardiac, they could be abdominal. So really, spanning the whole spectrum of disease. Fortunately, it didn't result in I know you used the words, a dam bursting after the executive order was lifted, for a couple of reasons. Because since these were elective, many patients opted to hold off because they could. Let's say if they're orthopedic pain, they felt they wanted to hold off for a little while. Some people came in as soon as the executive order was lifted. Other people wanted to wait until they had the chance to get vaccinated. So we have seen a lot of return of that business, and fortunately it's been gradual. So we've been able to manage all that from a capacity standpoint. The other thing that we're projecting as we think about, the rest of 2021, as you know, in Florida, we have a lot of seasonality, right? Folks are here during the winter time, and summertime's often the times they return to other parts of the country. We think this year there's going to be less of seasonality, because when you look at the Northeast, you look at the West Coast, unfortunately, they're still struggling with COVID in ways. Fortunately, we are not seeing this resurgence of those numbers. So we think as those residents remain here over the summer, we'll continue to, be able to accommodate them, which, like I said, usually we would see a bit of a dip this year because we will have that capacity. We'll be able to accommodate many of those procedures that during the executive order period were being postponed, especially because, as I mentioned earlier, a lot more folks have had the chance to get vaccinated now. So they're much more comfortable, getting back to their routine healthcare.
Okay. Amit, as long as I've got you on, how are you guys with, and again, my own lay perspective is that over the past decade or so, our society has become very much of well, I know I have, for example, if I want something tomorrow, I go on my computer today, I go on Amazon Prime, I find what I want, I press the button, and it's at my doorstep tomorrow. I've had the luxury by tomorrow of forgetting what it was I've ordered, and it shows up, and I go like, oh, look what Santa Claus brought me today. Let me see what I ordered. And it shows up. It's very seamless, very efficient, all that kind of stuff. And I have never needed to keep anything in stock because there's Amazon, there's Grubhub, whatever. And I'm assuming to a certain extent, you guys were all the same way with basic supplies, like whether it's PPE or, reagents or, all of those things that I know nothing about. But you were able to rely on there's a certain demand, there's a certain supply. All of a sudden, just like toilet paper, all of this stuff disappeared off of your, institutional shelves. How were you guys able to react to that? How did you handle that when that happened?
Well, I have to tell you that as much as I'd like to take credit for it, some of this was just good happenstance. I heard some of my colleagues talk about their ability to learn from some of their, sister or brother organizations throughout the country. Just by complete coincidence, we happen to have a few medical staff members, physicians on staff who had trained in Italy and still had very strong ties to there. So I actually remember very distinctly. Now it was a Sunday when I got a call from one of these physicians. He said he'd been in close contact, and this I believe was actually still in January, so way before any of this had come to the U.S. And he said, look, would you like to get on the phone with some of my, fellow physicians out in Italy just to see what's going on and see if we can learn anything from that to help prepare? And certainly, it really dawned on me the requirements that were going to be there from a PPE perspective. And I have to say that after that conversation, before we even had any cases here, I just went to my team and said, look, let's just order as much PPE as we can get our hands on, because we'll need that to protect, our team members. And that, really went a long way for months to come, because what happened was, as you alluded to, there really ended up being a constraint from a supply standpoint in the spring and the summertime as the surges came. Fortunately, we were able to build up enough of reserve that when there were delays in shipment, we were able to tap into that and really provide that for our team members and our medical staff. But like I said, as much as I'd like to take the credit for being prescient about it, it was just the right conversation at the right time.
Awesome. Sheri, you guys at Tenet are a much larger institutional player with, with partners all over the U.S. How did Tenet handle this, and how did that work out for you here?
Yeah, I think having the relationships and the purchasing power, being part of a large organization was very, very important early on. And also having 65 hospitals throughout the country, we're able to move inventory to different hospitals that are, facing the pandemic at different times throughout the country. So maybe in New York, they're facing it in January, we start facing it in March. We were able to, move inventory and ventilators and equipment and things like that to the hospitals that were really in need.
Mm-hmm. So, Cynthia, what I'd like to explore too is cooperation. And this is a good question, I think, for all of you. But, and again, I don't know the answer to this, but to the extent that you all cooperate with each other on a normal basis, day to day, during times like this, have you all cooperated as our regional hospitals together on certain initiatives, whether it be public education, encouraging mask wearing, working with the state health department, or anything like that? And how did you guys approach that as we're all in this together kind of a thing among the hospitals?
I think during this time there was great collegiality. And there was certainly support from the healthcare district, from the county, from the state level. There was routine incident command and information coming down from the state that we all participated in. And until very recently, I want to think it was like 2 months ago, we were still having these routine calls, somewhat similar to, and maybe it's the point to drive home, that even though COVID-19 is new, this pandemic, we're always prepared for emergencies. So it's similar to what we do when there's a hurricane coming. There's these regionalized calls that we're all on. So we're all on the same page, getting the same information and managing it just within our framework of our areas of control. So I do think we understand that we're all in it together. We're all treating the community. That's our responsibility. And we all want to be safe and effective for our staff as well as the community.
Okay, thank you. Anybody else have anything to add to that?
I'll just
Yes.
add a comment to that. A couple things. One is, as Cynthia mentioned, we had these, very collaborative calls with which the Florida Hospital Association, was facilitating. And it was great for us to be able to learn from each other because, even though we know a lot more about COVID-19 today, certainly in the early days, we all had to be very quickly adapting organizations, and the ability to have lessons learned from each other really was improving on a week-to-week basis. So I think that was great. Number two, just as we always have, because the reality of it is that, as medical centers or hospitals, and it probably competes the wrong word, whether we compete in elective procedures in normal times. One thing that we always know is that we've always collaborated, very well during times of, emergencies. And I think that it was great for all of us to know that if any of our hospitals were, inundated with COVID cases, we could count on each other to be able to, help with any overflow, which again, as a hospital CEO was really a great source of solace, because what we didn't want to have happen is, we've got people in the hallways, as we were seeing much in other places. We knew that if any of our neighboring hospitals had capacity, we could certainly count on them for their support, which I think was really a great comfort during the last year.
Hey, Rick, this is Lincoln.
Yes,
I
sure.
also wanted to add too that there's a lot of, besides the pandemic times, there is a lot of collaboration and a lot of opportunities for us to get together. So a lot of us on this call were members of the South Florida Hospital and Healthcare Network. We're on the Florida Hospital Association. So there's a lot of informal communications going on behind the scenes. If a patient lands at one of someone that we know, a loved one at another hospital, we'll pick up the phone and contact that individual and just let them know that we have somebody there, et cetera. So there is a lot of communications, more so than I think folks realize, between, well, if you call them competitors, but we're all providing the same kind of service in the community. So that's one thing. And I believe that, again, looking at Tenet, HCA, the Jackson, the Memorial, the Broward District, and Palm Beach facilities were all represented. There was a lot of communication going on during that time. So, we have a sister facilities up in Bethesda East and Bethesda West. So besides the internal communications within these facilities, there was a lot of communication going on with a lot of the folks in the Tri-County area, because really one county could be hit harder than the other, but you knew that wave was on its way up. So it's always good to keep track of what was going on. And again, I think these informal and formal communications really went a long way. That's my first point. The second point is I see Dr. Rastogi. I just wanted to take this time. Today is Happy Doctors Day. So I just wanted to wish Dr. Rastogi and any of the other medical staff members that might be joining us today, just wishing them a happy Doctors Day. And it's been an incredible year. And really not just the medical staff, the hospital staff, they've really stepped up to the plate this past year. And it's been inspiring. So I just wanted to wish Dr. Rastogi Happy Doctors Day.
Yeah, thanks, Lincoln. I just want to echo to any of the physicians that may be on the call, Happy Doctors Day indeed. As you said, it's been a very challenging year for us, for sure. And without the support and all the dedication of our medical staffs, we certainly couldn't have gotten through the past year.
I would like to think that we intentionally scheduled today's breakfast meeting for Doctor's Day. But no, we're not that good. So we're good, but not that good. So that's awesome. Congratulations to everybody. So how do you guys, so vaccines are rolling out and people are getting vaccinated. And on the street, I am feeling an awful lot of optimism right now in the general population. I see investment coming back. I see people generally smiling a lot more. I don't know if you can attribute that to the fact that people are getting vaccinated or to the fact that people think that this whole COVID thing is over, which I don't think it is just yet, or the fact that there's $1.9 trillion being released into the economy that's going to, make its way into people's pockets. But how are you guys seeing yourselves as part of this whole program with the vaccine, coordinating with the vaccine rollouts and getting folks back into the swing of things as far as, vaccination and health for the general population? Are you playing a major role in that? Or I know obviously the state of Florida, the federal government have their sites, and Palm Beach County Health Department has. How are you guys doing that? Cynthia, can I start with you a little bit on that?
Sure. I mean, here in Palm Beach, we really feel that the place for vaccination is in more of a traditional model, so whether it be at the CVS, the Walgreens, at a big vaccination site, we don't see the hospital as the leader in place for distribution of community vaccines. Certainly, we've offered the vaccines to our employees to keep them safe. For wider community population vaccination strategy, we think it's better in a more traditional setting.
Mhm. Awesome. Okay. That Lincoln?
Well, I was just going to add too that we have been vaccinating not only the employees, just like every one of us on this call is probably doing, but we've also been able to vaccinate quite a bit of our medical staff workers, our members, even folks from their offices. So if they have frontline workers in their offices, we had the ability to get additional vaccines. So we were giving them out. So if we got, let's say, 500 vaccines over a week period, we would give those out, and we would have prioritize. We also have a Lynn Cancer Institute here, so we had a lot of patients that were immunocompromised. So we were really targeting those folks early on, and we've been able to vaccinate quite a number of those that have other risk factors as well. So we continue to do that. Continue to see even more interest from medical staff members and hospital staff members that they were kind of on the fence during the initial vaccination process, which started towards the end of December. But now we're seeing more and more folks wanting to get the vaccine, and there's an incredible amount of demand out there still. So, but I agree with what Cynthia said as far as the Publixes and these other folks that can do these mass community vaccinations. I think that's the key. For that, I don't think the hospitals are geared up to be able to become a community vaccination center.
Sure. Okay. All right. Let me move on to
Rick,
maybe.
Rick, if I could just add
Oh yes, absolutely. Go ahead, Amit. Yes.
So I think that with the amount of vaccinations that are going to be required, and the last data I've seen across the country, and I believe this is pretty close to where we are Florida-wise, we have something around 25% of the population that's been vaccinated. And I know when you made the comment, Rick, that people may be thinking that perhaps the pandemic's over, and I saw Lincoln and others shaking their head, and they're absolutely right. I think we're all concerned about what some of the coming weeks hold. With that being said, I think that look, as much vaccine as we can give out at any site is a great thing, and for sure, the retail pharmacies, all that's been great. We've still been, vaccinating the community. Even today, we have 450 vaccines scheduled, so that's pretty much what we're giving out on a daily basis, and that ends up being a mix of. So obviously, early on, we started giving it to our medical staff, employees. We always have new members of those coming on. But in addition to Publix and others, we feel that for us to be able to be an access point is a service to the community. So we're still partnering closely with the state, especially with folks with comorbidities. Initially it was the 18 to 64. Now, as the general population cutoff ends up getting lower and lower, we're still partnering with the medical staff and docs, on especially on the folks with comorbidities, because I think our interaction with the medical staff and able to get those folks in is providing a great access point that they may not be able to get because of the executive order until that age level continues to come down during that period.
Sure.
I think what we'd like to do, and I'd be curious, Lincoln and Dr. Rastogi, like eventually we'd like to be at the point with to have the J&J vaccine, and just like we offer the flu vaccine, be able to offer patients the COVID vaccine if they weren't vaccinated, but that's just not available to us today.
Yeah, the J&J, that's the one-shot vaccine, right? Yeah.
Well, I think that, and that's a good point, Cynthia, is that and I agree. I think once the J&J vaccine is readily available, one of the biggest benefits of that will be is then even physicians in their offices can store that, because that requires only regular refrigeration. Currently the Pfizer and Moderna, because of the cold storage that's required, it does end up getting limited to pharmacies and medical centers, because at most physicians' offices that capability really won't be able to be possible. But certainly once the J&J is readily available, I think doctors' offices, and again, just going back to our theme earlier, we'll be able to create even more access points, which is really what we need to be able to get folks vaccinated as quickly as possible.
Mm-hmm. So another thing is advice that you guys can offer the rest of us. Sheri, I'd like to pick your brain a little bit. What sort of advice would you offer to, let's say, the pre-K centers, the restaurant operators, hotel, hospitality industry, that kind of thing, based on lessons learned and what you've seen them doing, not doing, whatever. You guys have been in the thick of this. They've been severely impacted as well. But what kind of advice would you offer those other folks in our society?
I mean, staying up on the latest CDC guidelines, I think, is the most important thing to do. General sanitation and staying up on cleaning is very important. The social distancing, the masking, and most importantly, probably washing your hands. I think that this is something that, has really changed things. And healthcare, obviously, it's something that we always do. But now everyone in society is washing their hands and using hand sanitizer at extreme levels. But all of those things only make the quality and the cleanliness better in any organization. So I think it's most important to follow those guidelines that the CDC is putting in place.
Okay. Anybody else have anything to add to that?
I was just going to add too that first and foremost, get a vaccine, get vaccinated. You're going to be helping out so many people to do that. And I look at the colleges in the area as well, and it's that young population they're the spreaders right now. But they would be the ones ideal for the J&J vaccine. It's a one shot, they're done. If I had to get my 17-year-old to get a shot and then rely on him to come back in however many days to get that second one, it's not going to happen. So I just think for the younger folks, it's probably an easier way for them to get vaccinated. I jokingly said the other day, we could just open up a center right around Las Olas Boulevard and get everybody vaccinated in one shot. But in reality, when you look at that, it's really, you got to get vaccinated. And to Sheri's point, you got to keep following those basic issues about right now, hand hygiene, wearing a mask until this becomes we finally get over this hump. But when you look at what's happened to this year with the flu season, we've had one of our mildest flu seasons ever. I wonder why. Well, because people are wearing masks, social distancing, and they're washing their hands. So I think this is something that we're going to be living with for quite some time, and it's probably a good thing.
Exactly. So after 9/11, we all now, before we get on a plane, we take off our belts, we take off our shoes. We have our, trusted traveler program cards. Life has changed. We get x-rayed, screened, examined, all that. What's going to change in your industry after this? How will your industry be different going forward after this? Amit, do you want to start that?
Well, before I address the industry piece, I'll tell you one social norm that's already changing is now if somebody, when they come to greet you, starts putting their hand out to shake your hand, I feel like it's one of those comedy moments, like, what are you doing? And we all kind of cringe. And it's amazing, how such a pervasive and social norm has all of a sudden become a sign of, listen, I don't think I want to move forward with that. Listen, from an industry standpoint, the analogy that I draw for most folks is when I was a medical student, I'll just say a few years ago, I won't give away the date, but at that time it was the really the peak of the HIV epidemic. And prior to that, it was not uncommon for healthcare workers who were drawing blood or handling blood products to not always wear gloves. That's when universal precautions came into place. And I think that served us well, regardless of whether, patient has HIV or anything else, that from an infectious standpoint. I think similar things are going to, take place as we go forward with regards to respiratory precautions and, just touch in general. I know Lincoln mentioned earlier about how the incidence of flu has decreased. If you look at the cases across the country, I believe they're down about 98% from past years. And I think those are going to be lessons learned for us, certainly, as we go our day-to-day operations. I don't know whether that's going to mean that are we going to continue to require masks, from here into, forever into the future. Those are things that will evolve, but certainly, there is going to be much more respiratory droplet and, any type of touch precautions than there have been in the past, because we've certainly seen that work, not just with COVID-19, but everything else that's been decreased as a result. And that's what I think that is going to impact our future practices.
I think the other thing is telehealth. I think that this pandemic providing easier access. I mean, telehealth's been around for quite some time, but it's not been heavily adopted. But with the pandemic, I think we will continue to see more venues available for patients in the appropriate circumstances to use telehealth for medical, as well as businesses. I think it's created a whole new avenue or venue for us to meet, as opposed to flying from destination. I think it's a lot easier, it's a lot safer, it's a lot less costly. But from the medical perspective, I think telehealth can be a good screening opportunity for patients who don't have either access or are fearful.
So that's one of those things that was probably coming but got accelerated, right? So before I call anybody else, I'd like to open to the audience, to the listening audience. Now's a good time for, if you guys have questions for our guests, you can use the chat box and start entering your questions into the chat box, and I will, as time allows, we'll go ahead and throw them out to our guests. Sheri, did you want to add something to that?
I just wanted to say also, I think it accelerated everything into the outpatient setting. So in healthcare, things were already moving to the outpatient setting, and the pandemic has really accelerated that pace. Things are definitely moving, total joints where they'd maybe be on an inpatient basis and the patient would stay the night in the hospital. They're now moving to ambulatory surgery centers, much quicker than I think would have had it not been for the pandemic.
Yeah, I noticed when I had my full knee replacement, 14 years ago, it was just, okay, I made an appointment. I had my doctor. I went into the hospital one morning, stayed, had my knee replacement, got out 3 days later and went into rehab. And that was about it. I ended up just doing a revision because I wore out the plastic piece and needed what my surgeon called new brake pads. So about 3 weeks ago, went in, and what I thought was going to be a fairly simple thing, we did about 2 weeks worth of advanced testing, blood tests, all kinds of things, obviously the COVID tests and all those things for a period of about 2 weeks before I actually showed up at the hospital. And it was very much like liking it to a much more enhanced TSA screening, before getting on an airplane. And very impressive, a lot more than I was expecting, but very impressive. So let me see, we have a couple of, yes.
Rick, I'm just glad that you consulted your doctor regarding your brake pads and didn't show up at MIVIS. Your outcomes may not have been the same.
Yep, I could have pulled into that parking lot and not been able to stop.
Right.
I would have come right through your front door. So we do have. So Evelyn Hopkins wants to know: do you envision a time when patients in the hospital are offered the COVID vaccine along with the flu or pneumonia vaccine?
As I said earlier, I definitely think that's coming, but I think it's when we have the single shot J&J. The challenge right now for us has been, if I give you the COVID shot and you have to follow up in 21 or 28 days, where are you going to be? Are you going to be in an ALF? Are you going to be, you know, are you not in the community? How are you going to get that second shot? So that's why we've not done that. But I think Dr. Rastogi, you had a thought too.
Just a couple things. So, you know, for some folks, we've already done that just because, so let's say if somebody was already scheduled and they happen to, you know, come to the hospital as their first shot. Part of the thing that we just have to be cognizant of is, so as many of us know, especially, you know, with Moderna and with Pfizer, a lot of folks, once they have the second shot, can experience flu-like symptoms. We always have to be careful that if somebody's in the hospital for an acute situation, we give them the shot and then they have symptoms after that. Will we be able to differentiate, is this a reaction to the shot, or is this, something that has to do with their illness? Well, I think that's great that we might be able to do that. We'll have to really evaluate what that means from a clinical standpoint as well.
Yeah, I was also going to add too, it's really dependent on the shelf life. So Pfizer, once you thaw that out, you only have a certain number of hours that you can give that. So it's almost like you're playing Russian roulette with, I'm going to thaw out this vial of Pfizer with 6 doses, but now who do I give them to? So you can't do that for each individual patient. But I think Dr. Rastogi brings up some good points about you don't want to be in the hospital with flu-like symptoms. Trust me, that's going to be a problem just with the regular staff. So I think the safest thing to do, and I believe Cynthia raised the point about a single dose. I think that would be a lot easier to do. But I think those vaccines should be given out in a community setting. More of an outpatient type setting, and not to somebody that's in the hospital.
Okay. All right, great. We have one more question, and we're going to start wrapping things up here because we have a special little presentation this morning. Question is, do you guys see yourselves opening up your facilities to nursing student clinicals for some of the nursing schools that are here in the area? And then I've got one question that I want to ask you after that. Amit?
Yeah, sure. Look, we actually even today have internship and mentoring programs, and we're always looking to expand that for sure. For us, part of what we feel is our mission is to be able to educate the future providers for sure. So we do that today, and we're always open to expanding that as we look into the future.
Okay. Ronald Reagan once famously said that the 11 most feared words in the English language are, I am from the government and I'm here to help you. Let's say you got onto an elevator and you ran into Joe Biden and he's standing there. What would you say to Joe Biden to say, here's what you can do to help me? What would you suggest to him? What's the best thing that the federal government can do to help you? Lincoln, you want to start?
Yeah, I would probably say we as a country cannot be reliant on another nation for valuable resources like PPE. So I would say, look out and see if there's any other opportunities to be able to get suppliers out there from other countries, just so we don't have just one country that, unfortunately it was China. The pandemic actually started there. So it put everybody else in the globe. It was a challenge just to be able to get the sufficient PPE supply. So just expand the resources out there for the country.
Okay. Anybody else?
I would agree with Lincoln.
Yep.
Most definitely. And also I would just add to roll out the vaccine as quickly and as efficiently as possible.
Okay.
The other thing that I'll add, and I agree with the comments that were made, I think those are incredibly important. One more thing would be to really have an organized public health education / communication plan, because one of the things that I think has been very frustrating for most folks during this past year was that to rely on watching the news, and this is regardless of which channel you watch.
Mm-hmm.
But we know that there was a lot of information out there. There was a lot of misinformation as well too. I think especially in times of crisis like this, when we look at so I definitely am not old enough to know about this, but when I look back at or when I hear from folks about during World War I and World War II during wartime, there was a great central messaging that was done that really helped folks understand what was going on and what to think about the future. I think from a public health standpoint, similar type of communication would be very helpful.
Awesome. Right now, I want to close this portion of the meeting. Make sure everybody hangs tight. Don't go anywhere. We have a very unique and special announcement to make. This type of thing, in our case, only occurs once every 36 years, kind of like Halley's Comet. We need to recognize one of our most talented, dedicated, and steadfast leaders who deserves much special recognition. He's made outstanding contributions to our local community. Today, we are recognizing Dennis Grady, our CEO, our president and CEO of the Chamber of the Palm Beaches, who has announced his retirement. Dennis has been with us for 36 years. He served on numerous boards, councils throughout the community, including being this year's chair of the South Florida Fair, and actively also participating on the board of Good Sam Hospital. We are going to now ask, I think we have a presentation coming in from Palm Beach County that we'd like Dennis to endure, and then he can offer a rebuttal afterwards.
Good morning. I need to start this on time and end on time. A little Grady humor. It is my pleasure to declare today, March 30th, 2021, as Dennis Grady Day. Whereas after having served for 35 years as president and CEO of the Chamber of Commerce of the Palm Beaches, the oldest business organization in Palm Beach County, Dennis Grady is retiring. And whereas prior to moving to Palm Beach County, he served as the youngest elected mayor of North Canton, Ohio for 3 terms. Whereas Dennis Grady is recognized for his advocacy of the uptown-downtown area now known as Rosemary Square, the West Palm Beach waterfront redevelopment, and the creation of the Kravis Center and Palm Beach County Convention Center. And whereas he has worked diligently on recruiting new businesses, fostering economic expansion of existing companies, and retaining jobs in the West Palm Beach area as well as the entire county. And whereas Dennis Grady has been on many boards and advisory councils, including serving as past chair of the Palm Beach County Convention and Visitors Bureau and past president of Sunfest. He currently serves as the chairman of the board for Good Samaritan Medical Center and chairman of the board of trustees for the South Florida Fair. And whereas he has previously served on the board of directors of the Florida Chamber, the Florida Chamber Federation, and the Association of Chambers of Commerce Executives. And whereas the ultimate sports fan, Dennis Grady was instrumental in the effort of South Florida being awarded the Major League Baseball expansion franchise of the Florida Marlins, as well as Palm Beach County's 2-team, 2-stadium spring training facilities, the Boca Bowl, and numerous golf events. Whereas Dennis Grady is the recipient of many honors with the 2018 Florida's Children First Child Advocate of the Year Award for his tireless efforts in the establishment of the Children's Services Council of Palm Beach County, holds a special place in his heart. Now therefore, be it proclaimed by the Board of County Commissioners of Palm Beach County, Florida, assembled in regular session on the 23rd day of March, that March 30th, 2021 in Palm Beach County is hereby proclaimed Dennis Grady Day. Be it further proclaimed by the Board of County Commissioners of Palm Beach County, Florida, that this proclamation is duly sealed, ribboned, and executed by the members of this board. The foregoing proclamation was sponsored by Commissioner Melissa McCauley, that's me, and upon unanimous consent of the board, the mayor declared the proclamation duly executed. Dennis, it's been a privilege to work with you. We hope that your retirement is fulfilled with relaxation, golf, and family time with Iva, Ricky, and Scout. And on a final note, thank you for letting me steal Kelly Burke from you. Congratulations.
Well, thank you very much, Commissioner. Grandpa used to say, leave the stage before they ask you to leave the stage. And after 35 and a half years, it's time to go on to the next chapter in my life. One of the things I'll miss mostly will be working with individuals like you, Commissioner, McCinley, who are dedicated to public service and give so freely of your time, energy, and enthusiasm to promote, develop, and maintain a quality environment and strong economic engine here in Palm Beach County and the state of Florida. My final thank you goes to 4 panelists, Amit, Cynthia, Sheri, and Lincoln. You, during the past 12 months, have served as our truth squad. Amit mentioned this briefly, but during the past 12 months, as in any crisis situation, the rumors are the things that can be most damaging to the local community. And you all, through your newsletters and willingness to answer questions that we posed when the rumors surfaced to the chamber, helped to calm, educate, and make our citizens realize that they had all of the expertise at the local level to meet the challenges of this pandemic. You all did a yeoman's work, and if any group is deserving of Times Men and Women of the Year, it's you and all of your fellow colleagues throughout the country who have dealt with this pandemic. Job well done, people.
Dennis, thank you. Thank you very much. I'm happy we're not arguing too much with Commissioner McKinley's presentation. It's all true. We as a community are unbelievably grateful for your time, service, and leadership. West Palm Beach County would not be the same without you. We're much better for you. Now, having said that, we know you're not going anywhere. We know where you live. We still got your cell phone number. And we will continue to be in touch and look forward to seeing you around and being the beneficiaries of your wise counsel.
Rick, I appreciate that and everything you've done, and the board of directors. And one of the things that makes me feel no apprehension about this move is the fact that Donald Burgess, longtime chamber employee, will be taking over as the new CEO, well equipped to not only do the job, but help take the chamber to the next level. If you give Donald the support and enthusiasm all of you have given me, it'll be a great next 35 years for the Chamber of Commerce of the Palm Beaches.
I think one of the greatest things you've done, Dennis, for the chamber is selecting and working with Donald and grooming him, and he has learned, and we are super excited to have the seamless transition, and he totally has our utmost confidence. So we couldn't be in a better position. And again, thanks to your leadership on that. So we know you're going to enjoy your time traveling with Iva, playing golf, much deserved relaxation, and we will be seeing, definitely seeing you around from here. Let me do some final closing announcements here. First of all, for the chamber, we want to make sure to thank our 2021 corporate full table series subscribers, Baptist Health, Florida Power and Light, GL Homes, Palm Beach Kennel Club, Reikenis and Associates, and the Palm Beach Post. Also, our 2021 corporate half table series subscribers, Florida Crystals Corporation, Ford Harrison LLP, Iberia Bank, Lamoya and Bone, Lewis Longman and Walker PA, and the Salvation Army. One more time, I want to thank our 2021 digital sponsor for all of our breakfast series, Baptist Health, who is represented today by our good friend and board member, Michelle McGovern, Director of Government and Community Relations. Stay tuned for news regarding our April breakfast meeting. We'll have news out on that shortly. And we want to make sure that you all have a very safe the rest of your week, great Passover and Easter weekend celebration, and looking forward to seeing you next time. Thanks again, everyone, for joining us today. This was an awesome presentation. Cynthia, Lincoln, Sheri, and Amit, thank you all for a great morning, a great hour spent together, and your wisdom as well. Thanks.